My name is Dr. Sanjay Ghosh. I'd like to talk to you today about the management of acoustic neuromas. Acoustic neuroma is a benign tumor that originates from the nerves that control hearing and balance. So if you look at this diagram, you have an external view of the ear, and this is a cutaway of the middle ear. And then we have an internal view of the inner ear. The inner ear is comprised of the labyrinth and the cochlea. And though the inner ear is connected to the brain, depicted here, by the vestibular and cochlear nerves. Acoustic neuromas are benign tumors that originate from the lining of those nerves. And the reason that many patients with acoustic neuromas have hearing loss is because as this tumor expands, it can choke off the nerve that controls hearing, and many patients with acoustic neuromas have hearing loss as a result of that. The other thing that acoustic neuromas can do is it can affect the nerve that controls balance, and so patients with acoustic neuromas can often have balance impairment. The other nerves that are in the proximity of this include the trigeminal nerve, which provides sensation to the face, and oftentimes patients with acoustic neuromas can have numbness in the face. The most crucial structure in this region is the facial nerve, and the facial nerve provides movement or animation to the face, and that is another structure that travels in this area and that can be intertwined with acoustic neuromas. Really, in this day, in the modern management of acoustic neuromas, the current state of the art is a three-pronged approach. The first approach to acoustic neuromas is simple observation. A certain percentage of acoustic neuroma tumors do not grow in a person's lifetime. And so it is reasonable to get an MRI of the brain at regular intervals and only then embark on treatment if there is growth of the tumor. This type of situation is most reasonable in very small tumors on the order of 1 to 5 millimeters in patients that are greater than 60 years of age. The second treatment option for acoustic neuromas is surgery. And the surgery to remove acoustic neuromas can be done through three different means. One is a middle fossa craniotomy, which involves removing the bone above the ear. The second is the translabyrinthine craniotomy that involves drilling out all of this bone of the inner ear and then gaining access to the tumor. And the third is the retrosigmoid craniotomy, which is an incision behind the ear that goes around the inner ear and gets to the base of the brain to allow for access of the tumor. The third option in the management of acoustic neuromas is radiosurgery. Radiosurgery is the precise delivery of radiation using a robotic device called the CyberKnife or a fixed device called the Gamma Knife, and delivery of precise dose of radiation right to the tumor, but in such a precise manner that the adjacent brain and brainstem are not injured. Patients with very large tumors sometimes require a hybrid approach, which is a combination of open surgery to remove a majority of the tumor, followed by Gamma Knife or CyberKnife radiosurgery for any tumor that's remaining that cannot be removed safely without great risk of damage to the facial nerve or the brainstem. If you or a loved one have been diagnosed with an acoustic neuroma, we'd be more than happy to evaluate your condition and provide you with state-of-the-art care for your tumor.